Being woken up at 3 o'clock in the morning can be very terrifying for a student. But then what made everything worse was I got called in for a call that I've never got to see or experience during my schooling, an eye surgery. Eyes are very complex and strange. So in most schooling settings, they try to avoid it because it can take so long just to learn the very nuances of it. But that night at 3 o'clock in the morning, I got called in for a ruptured globe, which also means an eyeball that's been penetrated. On this call, I've never seen it before, and I was very terrified. This was over 5 years ago. Since then, I've been employed for the Dean Magee Eye Institute, one of the largest eye institutes in America. I've probably witnessed close to 2,500 surgical procedures, from ocular plastics to retina surgeries to general ophthalmology and to trauma. During that time, I've become well rounded in pretty much all eyes, and even some of the most basic routine type of exams. One thing people fail to realize is that a dilated eye exam is actually a very important thing. Most people tend to go to maybe iMart or very kind of pop-up shops where they go in and get their glasses really quick, and that's it. Most people only thing they know is that they might have what we call astigmatism, which is an irregular shaped eye, and typically requires glasses. Most people can tell you my grandma's wore glasses or my dad wears glasses, but they don't know anything about any eye disease, nor do they get examined to make sure they're not at risk for any eye diseases. A dilated eye exam can literally it takes an hour, hour and a half a day typically at most. Yes, you will be blurry for most of the rest of the day, but for that blurriness, it's worthwhile. Without dilating your eye, that doctor cannot actually see what's going on in the back of your eye, which can be glaucoma, diabetes, macular degeneration, a tumor, a detached retina. The list goes on and on. So by failing not to have these, millions of people are typically walking around like a ticking time bomb waiting for something to blind them, which can normally be easily postponed or averted altogether if you just had a basic eye exam. Over 50 million people in the world, according to the National Eye Institute, estimates that go blind, have visual impairment, or lose partial eyesight for very basic eye diseases that could be prevented. Glaucoma, which is one, is a very prevalent eye disease. Yes, it is hereditary and there's not much you can do to truly prevent it, but the point is there's not much reason for anyone in 2018 to go completely blind for glaucoma. Typically, the normal patient that goes blind from a glaucoma are the patients that either fail to not take their medication as prescribed, or, which is normally the most common, they do not come in for an eye exam and they tend to be 65 years old and they probably should have seen 15 years ago, and by the time they walk in they have already lost pretty much all or have very little vision left. So at that point there's not much to do, and that tends to run with a lot of eye diseases. So a very basic eye exam actually prevents many of these ailments. Your eye is kind of like looking through a peephole. Without being dilated, that's all you see. All you can see is that person standing directly in front of the peephole. With dilation, you can see everything behind the person, including the wall, maybe even the apartment next door. So without being dilated, there's a lot of things that you just don't know. According to the American Association of Ophthalmology, diabetic retinopathy blinds more people in America than any other eye disease. Diabetes, which is very prevalent in America due to our obesity and our eating habits, tend not to be very well regulated. Same thing. Most people do not take care of their diabetes, which is a pretty common problem in the healthcare field. But on top of that, many people fail to realize that you are supposed to have your eyes checked annually if you have diabetes. Even with controlled diabetes and blood sugar, what can happen is the blood sugar in your body can actually raise your blood in the sugars in your eyes also, which can cause blurry vision. But the real critical aspect of the disease is it will start to grow new little micro veins and arteries all through the back of the eye. which can and will blind you because they will start to rupture and start to leak and bleed, which you cannot see through blood. So it will blind you. And once you lose that, you can never get it back. So it is very important for those type of people to have their eyes examined. Also, another very basic concept is certain treatments. There are very new treatments. Ophthalmology is a very diverse specialty because your eyes are so small and unique. We use a lot of James Bond's gadgets to see into the eye and take pictures and dyes and a lot of things because you really can't see the whole eye. It's so small and complex. You need microscopes and special mirrors and lights. One of the newer aspects, according to the Journal of Ophthalmology, is robotics. Robotics is starting to play a new role in ophthalmology because in a lot of retinal surgeries, which are very delicate, or even corneal transplant, which are delicate, the human hands only can do so much. Every human has a little tremor. Your doctor has to sneeze and cough just like you do. During those very delicate moments, it is crucial your doctor does not move or make any certain sudden movements. So robotics are starting to play a big role in newer retinal procedures. With that being said, there's a lot of other more basic treatments that are available, including cataract surgery, which uses laser, and sometimes it uses sound waves. There's retinal injections that we now have that 15 years ago we used not to have, where when patients had macular degeneration, it was pretty much a guarantee they would eventually go blind. At D. McGee, actually in Oklahoma City, one of the scientists actually realized that maybe you could treat macular diseases that are slow growing, like macular degeneration, like prostate cancer. Because of the diseases mimic each other, that scientist actually decided to take prostate medication, which we commonly call Avastin in ophthalmology, and inject it into the person's eye directly to the retina. And they realized the results are just like prostate cancer. It slows the vessels from growing to the point where it doesn't cure the disease necessarily, but it slows it down to the point where you normally can live a normal life without any visual impairment or blindness. There's more basic routine treatments like glaucoma drops that tend to help. They can be a nuisance. A lot of patients don't like to use them every day, but they literally will save your vision, and they're not that hard to apply. In a nutshell, to wrap everything up, a dilated eye exam is a very basic and crucial part of your eye health. Eyesight is one of those precious things that people don't realize until it's gone or it's threatened. Then they tend to panic. And most eye diseases could have been prevented if you'd have just only had a basic eye exam, spent 30 minutes a little blurry, and you probably could have prevented a lot of eye diseases or probably lived a long, happy life with all the vision and color you ever imagined. Thank you for listening. My name is Jeffrey Adams.